In this video, I'm going to be talking about the dentist's role in diagnosing sleep apnea and also how we can help to treat it and what our limitations are. A dentist is going to be the first one to notice sleep apnea because almost everyone with sleep apnea grinds their teeth. The reason why we grind our teeth is because sleep apnea quite often is caused by an obstruction. That's why it's called obstructive sleep apnea. The most common obstruction is your tongue. So we lay on our back, go to sleep, everything relaxes, our tongue falls back and blocks the airway, and the body's natural reaction is to wake up out of our sleep, to grind our teeth forward, to open the airway. We're not aware that's happening. Most people don't know they're snoring. Most people don't know they're grinding their teeth. Most people have no idea unless your partner says you're snoring and they elbow you, that kind of thing. Or you might feel tired. You might have high blood pressure, acid reflux. There's a lot of other things that start to happen as a result of sleep apnea. Even concentration is a big one a lot of people tell me about.
Last but not least, TMJ and headaches are a major symptom associated with sleep apnea.
We have the capability to make a mouth guard in a very specific position. And in my case, I like to make that mouth guard using this machine. It's called the pharyngometer. Pharyngometer is amazing technology and it allows me to measure your jaw in very different positions. It's gonna essentially measure your airway and give me a baseline of how big your airway is in a normal position. Basically using this machine, almost like a breathalyzer, to figure out how big your airway is. Once we know the baseline, we now can do another measurement by using specific breathing techniques to find out how your airway collapses, and we're getting a simulation of your airway collapse during your sleep. So we can compare your baseline to your collapse and know what degree of collapse you have. We use that information now and this technology to put your jaw into very specific position to make you a mouth guard that works really well for you, and it's really good starting position as opposed to guessing. This is myself, my scan, because I do have a mild case of sleep apnea, and this is how I treated myself and made myself a mouth guard to help me with in the treatment of my sleep apnea. Now there are other pieces of the puzzle because sleep apnea is not just treated by your dentist. It also has a lot to do with your nasal passages and how well you breathe through your nose. The goal of any treatment as far as sleep apnea is to get you breathing through your nose. And if you can breathe through your nose, now there's no need to breathe through your mouth anymore. And the tongue becomes almost a non-issue or less of an issue. So a lot of times in conjunction with an oral appliance, we're spending a lot of time on figuring out how to treat your nose. In another video, I did talk about how we treat nasal passages and things like that. And that can be done with things like nasal rinses. It can be done by working with your ENT to improve it, and he can find a lot of different treatment modalities. There's even certain versions of sleep apnea machines that help with nasal breathing, so you're not restricted to the full face mask that many people really dread wearing and can't tolerate. So this technology is amazing, super effective. I have this myself and I wear it every single night, and I really think it's a good way to go if it's properly made. So not only protect your teeth, but also protect your overall health and help prevent things like high blood pressure, tiredness, snoring, even death. Because you hear about a lot of people having heart attacks when they wake up, and that's because your heart takes a tremendous toll as a result of sleep apnea, because when you stop breathing, your heart rate skyrockets, develop arrhythmias, things like that that can unfortunately cause death. So super important to be treated. There's a lot of different ways, and I'll be talking about a lot of them, but again, this is something to take serious. So let's get you treated, get you sleeping better and feeling better. Thanks for watching.